China says the number of people infected by a mysterious respiratory virus has more than tripled over the weekend. There are now 218 confirmed cases of the new coronavirus virus, most of them in Wuhan, where the outbreak originated. So far, 3 people have died. This is a very serious condition. 4 other cases have been reported outside of China. And scientists say the virus is getting stronger and is being spread by human-to-human contact. And that is especially worrisome, as hundreds of millions of Chinese are expected to travel this week for the Lunar New Year holiday, and then airports around the world are not taking any chances. They are screening passengers for symptoms. Remember the days of SARS, for instance? Now, officials in China think they know where the virus originated. And a warning, some of the images in this story are graphic. Here's Christy Lustout.
Barricaded and guarded by police with masks, Chinese authorities have traced a new deadly virus back to this seafood market in the city of Wuhan. They say a new strain of coronavirus originated here and put an entire region on edge. CNN has obtained this video filmed inside the market, showing that more than seafood was on offer for sale. Images of the market from early December taken by a concerned customer indicate it was apparently selling other live wild animals, including skinned birds, snakes, and raccoon dogs, sparking concern that the virus might have been transmitted from animals to humans. CNN has not independently verified this footage posted on Chinese social media site Weibo, which has since been deleted by government censors, according to the poster. When CNN contacted the market, they would not comment. The School of Public Health here at Hong Kong University is a leading authority in the study of emerging viral diseases. Professor Liao Poon is a virologist at the university and was among the first to decode the SARS coronavirus.
I would believe that this Wuhan outbreak was caused by animal virus, and then the animal actually carried this virus and spread to human. And what we know is causing pneumonia, and then they don't respond to normal antibiotic treatment, so which is not surprising. But then in terms of mortality, SARS killed 10% of the infected individual.
Between 2002 and 2003, SARS infected more than 8,000 people and killed 774 in a pandemic that reached 37 countries. Officials say the new virus was first detected in Wuhan on December the 12th. Some of the initial patients were employed at the seafood market. Hundreds of kilometers south of Wuhan, at this market in the southern city of Qingyuan, wild animals are crammed inside cages. Mallard ducks, rodents, even porcupines, to be sold for consumption. It's not a unique sight in markets across China where both animals and humans are in close contact. This footage, not independently verified by CNN, is from Hong Kong broadcaster iCable, filmed on the 6th and 7th of January as the new strain was discovered. No indications any disease is lurking here, but according to the World Health Organization, scenes like this point to the potential risk of a new virus spreading.
These animals, we don't know their history. We don't know what kind of pathogens or viruses that they are having in their body.
In our interface with the animal world, there will always be the danger of spillover. As long as people eat meat, there is going to be some risk of infection.
The coronavirus that causes SARS was traced to the civet cat, a wild animal considered a delicacy in parts of South China. After the SARS outbreak, China outright banned the slaughter and consumption of civet cats in 2004. Local authorities in both Wuhan and Qingyuan tell CNN they don't know anything about the sale of illegal animals at such markets, and there are no open investigations. But 15 years after the ban, in this market in southern China, civet cats are seen lying inside cages, and this stallkeeper says he is selling them. Ready for purchase. Christy Lustout, CNN, Hong Kong.
Well, we've just learned that the World Health Organization will hold an emergency meeting on Wednesday in a couple of days to decide whether this coronavirus outbreak is an international public health emergency. Our senior medical correspondent, Elizabeth Cohen, joins me now. So do we know how many of the people who became sick actually went to these markets that Christy Lustow told us about in her report?
So, Hala, we don't have an exact number, but what's important to remember is that we do know that it has spread person to person. Let's take a look at that map that shows where this virus has been. Most of the cases are in Wuhan, but there are cases in other parts of China. There have been a few cases in Thailand and Japan and Korea. And so we know that some of these people did not visit that market, so they did not get it directly from the animals. They got it from a person. And one of the when I talk to experts, they've said the most stunning thing is that according to a Chinese health official on Chinese media, one sick person infected 14 healthcare workers. That is not good news. If that is correct, that means that this truly is infectious. So we know that it can spread person to person. The trick is, how easily does it spread person to person? And we just don't know the answer to that right now, Hala.
So that being said, then, are officials concerned? We all remember SARS. We all remember these outbreaks. Are officials concerned that this could be another SARS?
Yes, there definitely are those concerns. Let's take a look at those numbers. So there are two cousins, if you will, to this new coronavirus. One is called MERS, which is Middle East Respiratory Syndrome, which isn't as well known, but is much more recent. So about 2,500 infections, 858 deaths over the past 7 years or so. And then SARS, which you mentioned, more than 8,000 infections. And this was in sort of the 2003, 2004 time range, and 774 deaths. That is precisely what the World Health Organization, the U.S. Centers for Disease Control, that's what they are trying to avoid. And it really, to a great degree, hinges on the question, how easily can this be transmitted person to person? So SARS, for example, did transmit person to person. Fortunately, if you can call it that, it was a little bit difficult. It was people who were hugging and kissing who gave it to each other, people who were sharing forks and knives. Your likelihood of getting it from just passing someone on the street, it wasn't that kind of action that was giving it. That was spreading it, rather. So in this case, we just don't know. Can you get it if you just hug or kiss someone? What kind of contact do you need in order to spread person to person? Because we do know that it does spread person to person.
All right. Well, we are going to keep a close eye on this. Thanks very much for that.